Hey guys, I'm Katie. I'm an internal medicine resident, and I thought today I'd talk a little bit about how I prepare for my clinic days. I have continuity clinic tomorrow, and it looks like I have about 8 patients on my schedule. Whether or not they all show up or not, TBD, but that's how many are on my schedule. When I open up a patient chart, I like to look at the last clinic note. Since I'm a new intern, a lot of these patients have already been seen by the resident before me, and I took over her patient panel. So I like to look at the note that she wrote before and what they talked about and what they addressed during that visit. So I'll kind of start to create my problem list based on that in the assessment and plan. I'll also take a look at any notes or anything that's happened since that last clinic visit. So if they've been hospitalized, I'll read their discharge summary and look at any recommendations that were in the discharge summary. If they were seen by a specialist, I'll read through those notes and see if anything's changed in terms of management. And then I'll also look through any labs or imaging that they might have gotten done since seeing primary care last time. It's also important in primary care to address any care gaps or to talk about any preventive measures that need to be done. So for example, like an A1C or eye exam or foot exam for diabetics, things like that. So I'll kind of put that in the body of my note to remember to talk about those things during the visit. I like to put things in my assessment and plan, even if I didn't specifically talk about them. So for example, if a patient has hypertension and I'm continuing to prescribe a medication for their hypertension, even though we didn't talk about their blood pressure readings because they've been stable over the past few months, I'll still put that in my assessment and plan just so that I know for the next time I see them that this is what was done at this visit. We didn't discuss it, but I continued to prescribe this medication because their blood pressure has been well controlled on this medication. So yeah, I hope this helps a little bit. I thought this would have been helpful when I was starting on my clinic block on July 1st. So maybe this helps someone to kind of help organize their clinic schedule a little bit, or someone next year who's starting on clinic block on July 1st.